Thank you, everyone. Good afternoon. My name is B.Ahmadi. I'm working in Scotland, Scottish Rural College. I'm a vet and with agricultural economics background. So please bear with me when I introduce some economic concepts here, because I thought it's important to consider these issues in dealing with vaccine issue related to foot and mouth disease. So I start with some jargons. Apologize for that. Externalities. And then I start talking about endemic versus exotic settings, rationale for the government interventions in terms of animal diseases especially, and rationale for private sector or motives for private sector to get involved. Barriers to access foot and mouth disease vaccine, and continuous dialogue or training that is needed to solve some part of this problem. And some concluding remarks. Thanks for Kuhn to introduce some concepts already, but I'll start with externality. Basically, a consequence of commercial activity which affects other parties without this being reflected in market prices is known as externalities. It can be positive or can be negative. A positive externality, for example, when a beekeeper basically keeps their bees for producing honey. While doing that, the bees fly over the neighboring farms and help the pollination. So that's a positive externality, but it could be negative externalities in most cases, and contagious infectious diseases are examples of negative externalities of farming and keeping animals. At a larger scale, and for severe examples, at national or regional and international level, market cannot solve this issue. So that's when economists basically refer to market failure, and that's when our efforts in allocation of resources of the economy basically fails to produce a net profit for the whole society. Or in other words, we have a net social welfare loss. So coordination is often needed as a centralized body, for example, governments or associations or tribe heads or whoever can centralize this effort to deal with externalities. Coming back to endemic versus exotic setting, I thought it's important to notice and to distinguish between these two. When we talk about vaccines and our strategy to deal with foot and mouth disease. So endemic diseases are frequent outbreaks are expected. There is farm level loss, very widespread, often imposed externalities by misuse of vaccine or any sort of behavior, a low level of biosecurity by the neighbors, etc. And it has wider economic implications in terms of the impact on supply and demand of products and livestock, and impact on prices. But often there is no trade implications, and not always the case, but is not a trade implication as we have in terms of exotic settings. And impacts on animal welfare and also impacts on human welfare is important. In exotic settings, outbreaks are rare. We have eradicated diseases, or we don't have the disease already as a common daily basis, and often is limited to one region or maybe more. But the consequential losses are important in this case. And it has wider economic impact. It has a trade ban impact. I mean, the trade issue is very, very, very important in this case. And as we saw this morning about all the simulations, the duration of the outbreak and the duration that the trade ban is in place is quite critical. And impact of animal welfare and animal health is again the case. I wanted to a little bit touch on this issue of free market economy. I mean, on top of that, endemic and exotic settings, we need to consider that we are dealing with let's say, a free economy. I know the free economy doesn't exist. To some extent, all the governments intervene in the market. But the degree is very, very different. So we need to consider under which country and under which situation that we are talking about the policies related to controlling foot and mouth disease. So tackling the externalities, if we go back to literature of economy, we see there are different approaches. For example, one approach is taxing the agent who is causing the problem. Often tax equals to the difference between the private and social costs, and does not induce better biosecurity. If we tax, those who are basically imposing the disease or with lower biosecurity, but it basically lowers the density of production. And it can be very costly. The second approach in the literature is a Cogent Negotiation, which is basically, it says when there is no transaction cost, two agents, say two farmers, can reach to a unique, efficient solution by means of negotiations. And the condition here is basically the proximity of herds causes the problem of externalities. It's not about two very distant farmers. And when we add more agents into this, it becomes extremely complex, the negotiations. And therefore, again, you would need a centralized government or somebody to help with that. So then it brings us to the roles of the government. And so let's consider we are talking about free economy countries and exotic settings. Let's say European countries. We have these roles for the government: protecting human health against zoonotic diseases, protecting and promoting animal health and welfare in many European countries, and also in European Commission's regulations. These have been explicitly mentioned. Protecting interests of producers, the wider economy, and environment and society, and comply with international trade rules and agreements, including WTO, OIE, EU. Otherwise, we cannot trade our livestock and animal products. But this brings basically how government exercises their rights, if you like. So we have different mechanisms, like, for example, sermon, voluntary advice on biosecurity. There is a little compulsion here or a little liability defined for that. Carrots, or providing incentives, basically to maintain biosecurity or a disease status. Rapid reporting, compensation provided based on if you report quickly, you would get full compensation. That's the case currently for bovine TB, for example, or sticks, whether it's fine or sanctions or any punishments that basically impose on farmers or producers. There are also other methods, like we have heard about private-public partnerships, and that's happening in many developed economies. Insurance is another mechanism to regulate these externalities, and also cost and responsibility sharing that exists already in many countries, Australia and European countries. So motives for private sector. By private sector, I mean both farmers and to some extent other people involved in the chain, improving their technical efficiency and economic efficiency. Basically, they are maximizing their profit, avoiding their losses, and accessing better markets and prices. Quite often, they are after gaining a reputation and social status. And also they may have other motives which could be very crucial in terms of our control programs. So private sector issues in relation to those rights, if you like, first of all, require resources to invest in biosecurity measures. So we need to think about how to finance that. And poor health management by neighbours, as I mentioned earlier, reduces the effectiveness of any biosecurity measures that they may take. And it was also in Kuhn's presentation, if the private returns to investment in biosecurity is smaller than social returns, then farmers invest less than social optimum, and then we fail to protect and to control the disease. And also requires underpinning policies and partnership with the public sector. As I mentioned again, these are the case in mainly free market economies. So coming back to FMD vaccination issue, I have exchanged ideas with colleagues in EuFMD and also looked at the literature again. So these are some examples that we think is basically driving the problem as sort of barriers. So let's say assuming an endemic setting now with a lower degree of free market economy. So FMD is considered as a notifiable disease, as a global public good, as Kuhn mentioned as well. So governments think that they are responsible, they have to protect and to reduce the risk, and therefore there is very little room for private sector to get involved. Also, they are very honored about the service they provide, and any transferring of their rights to private sector would be considered as a defeat. Financing veterinary services is another example of using foot and mouth disease. Diagnostic problems, this is a very important issue. In the past, we couldn't differentiate between diagnosed animals and vaccinated animals, whereas with new vaccines we can. Licensing and marketing, it was mentioned in the previous session, I don't enter to that, but lack of capacity for policy reforms to encourage market-based solutions. That's a very key barrier, which in my view, we need to focus on that in the countries that deal with endemic situation. So I suggest a continuous dialogue and training, which EuFMD and OIE are doing it, about efficacy and relevance of serotype and strains, impact on differentiation, risk of outbreaks because of misuse, financing mechanisms, vaccine as one of the critical points, policy tools, and coordination at national and international level, and eradication program. So once vaccine is available, there are other issues. It was discussed about expected uptake or demand. So it's related to the behavior of the farmers and the risk profile of them. And price, extra costs, and all sort of practicalities about the supply chain of the vaccine. Impact at sector and national levels. What will be the situation after vaccines are available to the farmers, gainers and losers. Any program that's being applied at national level have for sure some people who will be losers in that system, which are currently perhaps gainers, gaining. For example, those farmers who are free of the disease, they are receiving more, better prices. Animal welfare issue, that could be a very, very major driver for controlling foot and mouth disease. Households economy in many endemic setups, and households food security needs to be considered as well. So concluding remarks, best solution is reducing the externality at the lowest price. This is based on economic theory. And marginal cost of investing in biosecurity measures must be lower than marginal benefit. That's basically people take it up. Taxing producers are very costly. Subsidizing biosecurity would be a way, combining with a strong control of the concentration points of the animals and also border controls. Access to vaccine does not guarantee full control or eradication, but in an endemic setting, protects individual farmers from private losses, and as a result of externality that imposed by other farmers. Particularly in endemic settings and less free market economies, effective public-private partnership is desperately needed, and we heard it several times this morning. And this will hopefully satisfy the right to access effective vaccine by private sector. So thank you very much for your attention.